The American Academy of Pediatrics is out with new vaccine recommendations for children.
And for the first time in 30 years, the guidelines substantially differ from the federal government's advice. Alice Gaynor spoke with doctors.
Back in May, Health and Human Services Secretary Robert F. Kennedy Jr. said,
"The COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule."
On the CDC's website now, it says whether a child gets a COVID-19 vaccine is up to the parent in consultation with a healthcare provider. But the American Academy of Pediatrics is strongly recommending COVID-19 shots for children ages 6 months to 2 years old, calling it, quote, rooted in science, saying the advisory committee on immunization practices of the CDC was overhauled and replaced with people who have a history of spreading vaccine misinformation. Is that confusing as a parent to hear that?
It can be, because you really don't know who to trust nowadays.
Edwin is the father of a 15-month-old.
Because there's so many vaccines that a kid receives within the first 2 years, and it's just, you know what, should I limit the amount of vaccines he's taking, or should I just, go based off what CDC says or my pediatrician?
First and foremost, talk to your health provider.
Dr. Michael Lucas is a general pediatrician at St. Peter's Family Health Center in New Brunswick.
There are family members who may have concerns about the safety of vaccines, and we understand that as pediatricians. That's why we're very thoughtful in the vaccines that we recommend to people. We believe it is the right thing to do to vaccinate children in the high-risk age ranges.
Dr. James McDonald is the New York State Health Commissioner.
The 65 and older group was the highest group that ended up in the hospital, but the second highest group is that 6 month to 2 year old group. And we didn't see great amount of uptake of vaccine in New York State last year. So I'm hoping we see a better uptake, in particular to protect our little babies from COVID this year, because COVID's still a thing.
Dr. Lucas adds,
don't forget, protecting them also in effect protects the family member who's in the home, who they might perceive as being at higher risk.
In a statement, the Department of Health and Human Services said in part, quote, the AAP is undermining national immunization policymaking with baseless political attacks. Alice Gaynor, CBS News, New York.